So thanks everyone for joining. We'll just get started in a few minutes. We can probably get started while a few more people are still trickling in. So thanks everyone for joining today and for the slight change of date from our previous session. So this is our fourth in the series around implementing together. So we started with some reintroduction to what we mean by implementation, and today we're really going to get into some of the science and practice of the sustainability side of things, and really looking at some of the work that's been done around Shelbright, how we're thinking about our legacy and sustainability. So it should be a really interesting session. Unfortunately, we did have a very last minute change of plan, and unfortunately, the speaker, Jess Silver, who's a core member of our team, isn't able to join today. So you will notice that she's got reflection slides that are integrated throughout our presentation, but hopefully she'll be able to record that as a separate session. So when this goes out, I would recommend taking a look at a separate video, which will go through her perspectives around sustainability and her personal experiences. So you'll get little snapshots, but not going to to put words in her mouth. So we're hoping to be able to hear from her separately. So I will now pass over to Zinat, who will take it away for our presentation.
Yeah, I'm gonna just share my screen. Okay. Okay. Um, so hi everyone, it's nice to meet you. As Celia said, my co-presenter Jess couldn't make it today. I just wanted to mention, they are a PWLE, which held, right? They're on multiple committees. They are also, a researcher, a medical writer, editor, and a founder of a nonprofit. So they hold many roles, and they were a crucial part in creating this presentation. And hopefully we'll have their reflections potentially recorded elsewhere, and you can view those afterwards as well, along with this presentation once everything's uploaded. But my name is Zinat Ladek, and today I'll be chatting about planning for sustainability. I'm a Childbright Graduate Fellow, a PhD candidate at the University of Toronto, and a doctoral training at the Office of Spread and Scale at Women's College Hospital, where I actually work alongside Celia. So just want to first mention that I live and work on the traditional lands of the Huron-Wendat, the Mississaugas and Mississaugas of the Credit First Nations, the Anishinaabe-Waukee, the Haudenosaunee, and the Petun. And this is actually a picture of a garden near where I live at Richmond Green Park, where they've actually planted prairie sage just so that it's more accessible to the community. And they've done this in a few parks around Richmond Hill where they've planted prairie sage or sweetgrass just so that it's more accessible, so that people can enjoy it in terms of its properties, and it's also contributing to the ecosystem as a pollinator. So just a fact about the area that I'm in, of where there are Indigenous lands, and that these meeting places are home to many Indigenous people from across Turtle Island. So today I'll go over a bit of an introduction about myself, and my co-presenter who's not here today, and then we'll go into sustainability, how it aligns with implementation science, a project overview of how we used the program sustainability assessment tool related to the sustainability of the Childbright Network, and then we'll go into some results of that project and end off with some pieces about knowledge mobilization. Okay, so a little bit about my journey to implementation science. So my master's was actually bench side research. So I was in a lab doing lots of cell culturing. My work was actually related to looking at a natural product that was derived from broccoli and seeing how it could prevent neurodevelopmental disorders in utero, so during pregnancy. Um, when I finished my master's, I actually did a small internship where I was first introduced to implementation science. I did it for about a year or so. And that's also where I learned about qualitative research. And that led me to doing my PhD in more qualitative research type of stuff and in health services focused on maternal care. With that, I did the Health System Impact Fellowship through CIHR, which is where I got introduced to the Office of Spread and Scale. That's where I really broadened my learnings in implementation science and kind of led me to this graduate fellowship as well with the Child Bride and with Celia. And so now I'm all about implementation science, trying to learn more wherever I can, and do love the field. So that's a little bit about me and my journey to implementation science. And so I wear a few different hats. I'm a student, so I'm a doctoral trainee at the Office of Spread and Scale and a PhD candidate at the University of Toronto. I do work in implementation science, but I also do have a passion broadly for maternal and child health and health equity. And then I'm also very much a lifelong learner, both as a mentee and a mentor. I'm also a wife, sister, daughter, and friend. And so Jess couldn't be here today. This is a snapshot of their journey. They are an individual with lived experience. As I mentioned earlier, they're a medical writer. They have experience in healthcare, expertise, and knowledge mobilization. And they're the founder of a nonprofit called Flex for Access. A little bit more about Jess. They're also a wife, sister, daughter, friend, mentor, educator, and advocate, and they also wear many hats. So throughout the slides, you will see things, you will see some slides that mention Jess's reflections. And as mentioned earlier, because she's not here today, hopefully we'll have them recorded and you can view them afterwards with the upload of this recorded presentation. So now kind of jumping into the crux of the presentation, which is all about sustainability. We're going to start off with a polling question. I'm going to get Corinne to pull up the poll. And the question for the poll is, how familiar are you with the concept of sustainability as it relates to implementation science? So either you're not familiar, somewhat familiar, you've got a general understanding of it, you're quite experienced with it, or you're an expert in it. So if you can pull up the poll and submit your answer, and then we'll just show what everyone's kind of mentioned. And if you can't see the poll, maybe just mention in the chat, but I think everyone should be able to see it.
Mm-hmm. Yeah, we'll just give it a little bit more time. Okay. I feel like everybody's participated at this point. I just let in someone else, so I'll just give it a couple more seconds. If you're just joining, we're doing a poll, Q1 for sustainability. So if you have a chance to review and respond, please do so. Sharing the results.
Great. Thanks so much, Corinne. Okay, so Corinne was able to share the results. So most have a general understanding, some are experienced, some are not familiar, or some are familiar. So that's totally fine. Hopefully today, if you are not familiar or somewhat familiar, you'll have a general understanding of what sustainability is and its importance. And for those who are experienced, you'll be able to learn a little bit more about the application of our framework that we used for our project to plan for sustainability. So this is good for me to know. And if I'm going too quickly through the slides or anything, please put your questions into the chat, or if it's an urgent question, please put up your hand. I want to make sure that you are understanding as we're going through the presentation so that you're not confused at the end of it. Okay, so we'll continue on. Okay, so there's a few different definitions of sustainability out there. This one that I have here is by Rachel Shelton and colleagues, published in 2018. Sustainability is the continued use of program components at sufficient intensity for the sustained achievement of desirable program goals and population outcomes. And so with sustainability, a few things to consider is that it's a dynamic process. So it's not just going from beginning to end. There are kind of changes throughout, there are shifts throughout the process. So it is dynamic. Trust in health and healthcare practice and interventions is also something to consider. Trust by users and the patients and consumers in being able to, for something to actually be sustained and for them to be able to trust that something's going to be sustained. There's a concern of long-term impact of interventions. Many times some things are discontinued, or they're ineffective, or they keep going, but they're less effective. So keeping to what it was actually meant, what a program was actually meant to be doing from the beginning, and making sure that long-term impact is sustained. There's also a loss of investments, time, resources, and people, which really impact whether something can be sustained or how the mechanisms of how it can be sustained. So just a few things to consider, and we'll touch on this a little bit more. One thing to always ask is, should something be sustained? We don't always want to imply that everything should be sustained. Some things are ineffective. Some things tend to harm more than they do have positive effects that we don't always realize. So it's always important to ask, should something be sustained, rather than just implying that everything should be sustained. And so as we're planning for sustainability, it's also important to think of the different outcomes that can be measured for sustainability, and that we want to think of what outcomes we want to measure from the very beginning so that you can account for them very early on. So thinking of, what type of health benefits are you planning to measure through your program? What partnerships or collaborations are you going to have? Different practices, procedures, different policies that might be impacted, what type of adaptations you might want to have, and what type of adaptations you might want to measure throughout your program, whether your program is meant to be spread and scaled along with sustainability, and then also looking at the unintended consequences of the program or intervention that you're planning for. So things that you might not anticipate, but they might emerge as your program continues on. So looking out for those types of things and being able to try and measure them is important as you're planning for sustainability. And again, just emphasizing that you want to do this from the very beginning, not from when you've got your program implemented and then you think about sustainability, which often happens most of the time. But we're trying to emphasize that you need to think about these things much earlier on in the process as you're planning to develop your program before implementation. And so to quote Benjamin Franklin, if you fail to plan, you are planning to fail. So planning for sustainability early on is important. And a key consideration as you plan for sustainability is the balance between fidelity and adaptation. So these pictures here show this nicely. So fidelity is essentially staying true to what you originally set out to do. So the original goal, the original protocol, this is the specific outcome you wanted to see, and staying true to that original goal. Adaptation is changing things to meet your surroundings, to meet your contextual needs, to meet the demand of changing populations or changing policies or environments. And so as much as you want to keep to the fidelity, so keep to that original goal, you also want to be able to adapt to the environment as things move along. So again, going back to sustainability being a dynamic process. And so the balance of fidelity and adaptation is crucial for something to be sustained, because even though a program might work effectively, this year, things might change. There might be a pandemic, the environment might change. And so then you need to adapt to be able to make the program still effective while keeping in mind some of those considerations like unintended consequences. So balancing fidelity and adaptation is important and something that can be considered throughout sustainability planning. So with sustainability planning, as it relates to implementation science, within implementation science, there's many theories, models, and frameworks that can be helped with doing research and evaluation, and the same goes for sustainability. So there are frameworks and models out there specifically for sustainability planning and implementation science that can be helpful. And so this is just a list of some examples of frameworks that could be used to help with sustainability planning. They're meant to help guide your planning, help you consider aspects of sustainability across the implementation system. So it really helps you in figuring out where you can start, what you can consider while you're planning for sustainability, and gives you some of that structure rather than guessing where to start from. And one of the ones that are highlighted here is the Program Sustainability Assessment Tool, or for short, we're calling it PSAT. And we'll go into PSAT a little bit more later on. Okay, so this is one of Jess's reflections. I'll just mention that she's the founder of a nonprofit called Flex for Access. And this was a huge reason why Jess was interested in this project and interested in sustainability as it relates to then being able to sustain their nonprofit. And hopefully you'll hear from Jess a little bit later on in her recorded reflection. Okay, so now I'm just going to go over the project that this work is based off of. And first want to highlight that this project has a much larger than myself and Jess. This team is made up of quite a few different people. It's led by Celia. It includes postdocs and previous postdocs from Childbright and people with lived experience, including Karina Crumpler, who was previously on the project, and now Jess. And it's also been advised by the Legacy and Sustainability Task Force at Childbright. I just want to emphasize the crucial importance of engaging with people with lived and living experience for this project. From the beginning, we've had that engagement, and it's been super crucial in helping us figure out who we need to talk to, how to talk to those individuals across the Childbright network, and what questions to be asking different people, and what's important to the members of the network. And that's really guided how we've collected our data for the project and how we've shared our results across the network as well. So now a little bit about the project. So this project came about because the network kind of wanted to know what they should continue and how to continue different things across the network. And we know that it's important for ongoing support for children with brain-based developmental disabilities and their families. And so because they wanted to understand what they want to continue and how to do it, our aim and our goal within this project was to explore the perspectives of Childbright members about what aspects they thought that the network's impact and capacity building efforts should be sustained and strategies to sustain them. So essentially, we were talking to people about what they thought was working well, what they thought could be changed, what they thought for sure should be moved forward, and how they were evaluating sustainability across their different programs and projects, and really what was just important for them about the network's impact overall. So with this project, it was very much implementation science focused and patient and partner oriented type of research. It was guided by the PSAT frameworks, the Program Sustainability Assessment Tool. And we did focus groups and interviews from September of last year to February earlier this year. And we spoke to 56 members across the ChildBright network, 41% of which were people with lived and living experience, including parent and patient partners and youth individuals as well. And from these members, they spanned across 13 groups. So the programs, so for example, the implementation science program, EDI, training and capacity building. So those programs, the research projects, and the different teams within the network. So we spoke to 13 of those across the network. So we covered pretty much every area of the network from those 50 different members. And so next I'll go into how we conducted the project using the program sustainability assessment tool as a guide. Okay, so the Program Sustainability Assessment Tool, or PSAT, it's a self-assessment tool to assess the sustainability capacity of a program or evaluate the sustainability of a program. And it includes 8 domains here, as you can see within the diagram. And this tool, it can actually be used as a survey tool or a framework. So if you were to use it as a survey tool, so this is a snapshot of what it would look like. And so this particular question is related to program adaptations, which was one of the 8 domains on the PSAT. And so you would essentially assess your program to see to what extent it meets the program adaptation domain. So for example, the first one here, the program periodically reviews the evidence base. So whether the program does that between 1 and 7 on that scale, and that's how you would assess the program. And you go through each of the 8 domains and you complete the self-assessment, and it kind of gives you an output related to how well or how capable the program is to be sustainable, and potentially what next steps can be done to improve the sustainability for that program. We did not use it as a self-assessment tool within our project. We use the program sustainability assessment tool as the framework. So we looked at those 8 domains. We looked at these 8 domains and essentially used them as a guide to consider for sustainability for the ChildBright network. So I'll go into a little bit about these 8 domains and how they relate to sustainability of the ChildBright network. Okay, so one of the 8 domains is funding sustainability. And I'll just mention from now that we've got a lot of quotes. I won't read all of them out, but you'll have a recording after, and you're welcome to read all those quotes later on. But I might highlight some of the quotes. So one of the 8 domains is funding sustainability. And we defined this as a consistent financial base for the network as a whole, and for the specific projects within the network. So maybe, for example, consistent funding for a research project, for example. Different financial trends that change with environmental trends, how funding affects network services and outputs. For example, people might be worrying about financial stability. Different types and diversity of funding that contribute to the network, as well as funding logistics. So being able to use available money, or the restrictions to using available monies that are within the network. that was what we did for funding stability. We also looked at partnerships. So we decided that there were really two categories for partnerships within the network. There were the internal partnerships. So that was essentially connections within the network. So between programs and projects, or between different programs and programs. So for example, connections between the KM program and the IS program, so the knowledge mobilization program and the implementation science program, or maybe it was a connection between the knowledge mobilization program and a specific research project that needed those expertise. Different types and diversity of partnerships within the network. And then we also had external partnerships. And so these were connections between the network, so projects and programs within the network with external organizations and communities. It was also partners external to ChildBright acting as champions, supporting in funding, awareness and capacity building. And this also goes for partnerships with external communities with outside the network. And so a nice quote that we have here that kind of represents these external partnerships is by a program member that we did an interview with. And they say, I think it's really important that we build relationships with Indigenous communities that are built on trust and shared goals that allow us to collaborate in ways that truly resonate with Indigenous communities. And that's just one example. Another one of the 8 domains is organizational capacity. And so within this one, we defined it as internal supports and resources, such as administrative support that were needed or required by individuals and groups within the network. It also included supportive leadership, key people as support. So I remember one of these key peoples being, administrative individuals who are super supportive. Individuals being aligned or misaligned with network goals and network initiatives. And then in general, human capacity was also within here. So different skill sets for people. Turnover and succession was important, and workload for individuals. We also looked at program evaluation. And so we defined this one as assessing the network to inform planning and documenting results, so including funding reports. We also included in here fidelity, so keeping the network on track with the intended goals and outcomes, like I mentioned before, keeping true to what you originally set out to do. Assessing network successes and impacts within each of the programs or research projects and as a network overall. And accessing network areas for improvement, so looking for areas where things could be adapted or changed for the better. We also looked at communications, and again, this was split up into an internal and external. And so within internal, we looked at communications within the network to promote specific groups and projects, to build internal network supports and buy-in from members, communication and exchange between groups and projects. So this kind of overlaps with the partnership as well. And then internally communicating what's outlined in terms of different roles and expectations of different types of members. And then with the external communications, we looked at network visibility to the public. So how the lay public in different communities, how they see ChildBright and the impact of ChildBright on the public. Communication with partners and the public and the network. Promoting what the network does and why, so getting that word out there about ChildBright, and building support and buy-in from partners. And we have a quote here that I'll read out by a committee member that says, I'm in other rooms where people's ChildBright affiliation is not overt. And I don't know if that requires supporting capacity development or what tools that people need to feel empowered as ChildBright ambassadors. So I really like this quote. It's really emphasizing how, people and members within ChildBright have the potential to be those champions and be those ambassadors for ChildBright to really promote what we do as a network. We also looked at environmental support, and we defined this as supportive external environment, so broader than the ChildBright network. We looked at economic and political climate of the network. We also defined it as support of decision makers and leaders who have influence within and outside of the ChildBright network. Things like, policy changes and shifts between phase 1 and phase 2 and potentially phase 3 of the network are things that would impact this domain, and even impact of external organizations such as CIHR or the SPORE networks. And lastly, within the PSAT framework, we looked at the strategic planning domain. And this was essentially active processes to guide network directions and goals and strategies, including the patient-oriented research strategy, active planning for sustainability and long-term goals, the future of the network. So this project, for example, is an example of part of that sustainability plan to inform the future. Also alignment with larger external environment and goals, large scale adaptations, so big picture views, being able to document roles and expectations within the strategic plan, succession planning and turnover plans, and having that documented, that protocol for what happens next is very much a part of strategic planning. So that was the highlight of the PSAT domains, how we defined them within our project, and a couple example quotes that show how those domains came out from the interviews and focus groups that we had. And a couple points here on reflecting on the usability and applicability of the PSAT as we were using it to assess the sustainability of the network. One thing that we came across was that the partnerships domain within PSAT is complex. We had a bit of difficulty defining what we meant by partnerships because a network is so complex. You've got your research projects, and then you've got your programs, and then you've got the core teams, like the central office, for example, or communications or the executive committee. And knowing where all those different pieces fit as partners was complicated. And in addition to that, it was even more complicated because you've got your partners with lived and living experience and that patient-oriented research aspect. And so the category of partnership just didn't fit all of that into it. And so we had to actually have other themes and codes that we had outside of the PSAT domains as well, which I'll get to in a little bit. As I kind of already mentioned this, but just in general, the complexities of applying the framework in a research network with all those multiple projects and programs, as opposed to it being just one program that we were assessing. People with lived experience, their engagement in patient-oriented research ran throughout. So it was very much embedded throughout each of the PSAT domains. And so it ended up being also a category extra on its own. So as I've kind of been mentioning, we needed additional codes and themes to complete our synthesis because not everything fit inside the PSAT framework just because of the complexity of the research network. And so I'll go over a few of the themes in a little bit more detail, but in we had these are the ones that we had outside of the PSAT framework. So we also looked at the goal of the network overall. So what the different members thought the goal of the network was, and how that changed based on the type of member that they were, or the type of hats that they wore within the network. The specific goals of the projects and the programs as it related to them as, you know, a group on its own, or as a group as part of the network. In general, being a part of the network was an interesting theme that came out. We also looked at personal and professional development of individuals, um, people with lived experience, engagement with them, and patient-oriented research. And we looked at specific sustainability strategies that were coming out from the members. So we'll go into some of these in a little bit more detail. So being a part of a network was an interesting one that came out because the network is just so complex. And so we looked at the benefits and disadvantages of being a network, the additional opportunities provided through the network as opposed to just being a part of a research team, the logistical and accessibility barriers alongside the flexibility to be responsive, and the strong impact of the network on trainees who gain experience outside of their projects. And so I'll read out this quote here from a committee member that says, "I think that's the difference between a research project and a network for trainees, is they're not just benefiting from the project, they're seeing the whole experience of the network that is such a rich experience for trainees that is really different from just being focused on the project." So really emphasizing that trainees get a much broader experience versus just being a part of a research project, which is really nice to hear that impact from the network. Looking at personal and professional development, we had both formal and informal definitions for this. So within formal, it was about career development, specific training opportunities, whether trainees came back to the network in the future through some sort of a formal pathway. And then we had informal opportunities such as learning on the job, personal reflections, trainees coming back by happenstance in the future to the network. And so this one, for example, like this one and even the one before, being a part of the network, they don't really fit into those other PSAT domains. And then with PWE, engagement and patient-oriented research, this was throughout all the domains. So we kind of had it on its own to make sure it was emphasized because it was a really big part of a network. And it's really the reason that many of us are here. And so this includes the parents and the caregivers that we engaged with, and the youth partners as well in the network. And so the involvement and relationships of these people with lived experience in network operations and in research projects was key. Ongoing support for these individuals and these members. And there was also a desire to increase leadership for people with lived experience and their roles within different research projects and programs. And so a really nice quote here from a PWE member within the network who said that Chalbright has done better than most at integrating different perspectives into their work so far, particularly through the active integration of the youth partners and a number of parent partners. And you know, this theme was prominent throughout, that the network does so well at really integrating and engaging people with lived experience, and that there's different opportunities that are still possible to take part for the people with lived experience that they're eager to do, such as taking on those different leadership roles. And then lastly, we wanted to look at specific sustainability strategies, so actionable strategies that are either already working towards sustainability in the network, or ideas that have the potential to improve the sustainability of network. And hopefully we will compile a list of these specific sustainability strategies that the network can action as they move forward. Okay. So that was the project results. And then I also want to share a little bit about our knowledge mobilization that we're still working throughout or towards for the project. So knowledge mobilization and the impact of our project results. So our results are helping, hopefully, to shape the future of the Child Bright Network. There are ongoing conversations with the executive and the steering committees. Um, and our results are also guiding conversations with potential funders and prior funders as well. And they're being used in reports about areas for future improvement and progress. And these conversations are iterative, so they're ongoing. So they've been going on since we started the project. As we learn a little bit more from the members, we're sharing things, and then those actionable strategies that have been coming out have been already started to be implemented over the last few months, which is really nice to actually see some of that impact happening. And we've also been sharing the results as much as we can in different ways. So it was shared at the virtual symposium of Child Bright. It was also shared at the executive retreat and ongoing executive meetings, as I mentioned. It was also shared at the Child Bright community meeting, where we received feedback on the results and ideas for the future of the network. Things like this presentation. We'll also be sharing it in the Child Bright newsletter in a formal way, sharing the strategies with the executive and communications team. We'll have a public-facing report and a scholarly academic manuscript that we'll publish. And just emphasizing again that we're trying to do things, iteratively as opportunities come about for us to be able to share some of these results so that we can improve the sustainability potential for the Child Bright Network. And Jess has expertise in knowledge mobilization and wanted to reflect on this as well, but hopefully we'll have some of her reflections, as I mentioned, in an upcoming recording. So that kind of wraps up this presentation. I think we're a little bit early, so I'm happy to take any questions or discussion. And maybe I'll hand it over back to Celia.
So great. It's always nice to hear all of these come together and the ideas that are really emerging from this results. So thank you. So we will open it up for questions and reflections. And I know many of you are part of the Child Bright Network. A few of them are might be newer, but just curious on your reflections on what you've heard or any questions that you might have. I can get us started on a question. Christina, if you like, you're still very much in the results and looking through this. So was there anything that kind of struck you while you were putting this presentation together, even about how some of these pieces connected, or anything that you hadn't a different way that you were thinking about some of this?
I will say what was nice was how much engagement we got. And I'm sure you agree with that too, Celia. And one thing that came about was, so in our conversations, in addition to all the data and information that we got from people, they appreciated having the moment to actually share some of their thoughts. And so that came about as an idea on its own, to have opportunities for people to share their thoughts and ideas a little bit more often, which I think is why some initiatives came about, such as like the coffee chat that happened and hopefully will happen more often. So I think that was I wasn't expecting to have that kind of engagement and interaction and that positive aspect that came out of that. So I'd say that's something that I would highlight, that was unexpected. That was a nice thing to come out of everything.
Uh, And I can add my own answer while others are thinking of questions. But two parts for me is one, that I found that this has been one of the most um, active uses of data from basically the day we started collecting data. So even we were just had started a few of the interviews and focus groups, and we're already starting to present preliminary ideas back in different ways across the network. And the town or the community meeting that was held a few months ago that was really to be able to get more people's perspective on how they think the network can go. So it's the true integrated translation of knowledge throughout the project right from the beginning. And as Zeynep mentioned, the huge response. I was just looking at our original application for this, and I think we said that we were doing like 8 focus groups and ended up getting 56 people. So the response has been amazing, and that also means that there's a lot more work and analysis than we had fully thought about. And we've got a question, so Corinne, go ahead.
Thank you, Celia. Just to say that I also noticed this as well, Zena and Celia, in terms of some of the immediate impacts that this work had, from the engagement program on our engagement council, just some of our processes, things that we heard from our members that we were able to implement right away, or that's part of our planning for meetings that are going to happen in the fall, for example. But I did have a question for your knowledge mobilization plan. I was just curious if there was going to be something else maybe added after speaking to youth research partners, because sometimes with from their perspective, we might hear ways in which they would like to have knowledge shared with them.
Yeah, that's a great question. So I think with our knowledge mobilization, once we have, you know, preliminary ideas of what
Results.
our data says, yeah, because there's just so much to go through. We actually want to kind of go back to some of the groups we engaged with initially to see if there are any other ideas. And I know the youth have a lot of ideas. They've, got ideas of podcasts and other things and stuff like that. So I'm sure they'll have different ways that they want to share the results. And so I'm hoping to continue engaging with those individuals to see about different ways that we can share our results.
Yeah, and also recognizing that there's a lot here. Like Zena just presented a whole lot of categories, and we could really use the help in thinking through what is interesting to who. So we can kind of see some of the academic side of things, but going back to other groups to be able to talk through some of this, what are the key points that we could build on and kind of go from there on some of the ways that we can share this information more broadly.
Also, I see a question from Sierra Lynn. How can you fix unsustainable team practices while your team is busy with their own work? I find time gets in the way of keeping things running properly. Great question.
That's a difficult question. I mean, I know it's always difficult when your time is taken away with, daily operations. But I think starting small to see where you can embed different practices, so at least you're not changing things on a large scale, but thinking of what you're already doing and how to combine different things that are already happening. Um, and it might take a little bit of time away, but doing maybe a small assessment to see what's working well and what's not, what's necessary to continue versus what's not necessary, to be able to manage your time a little bit more effectively in that way. Um, if I had maybe more specifics of exactly what, then maybe we can advise a little bit more. But Celia, I wonder if you had anything that you wanted to add.
Yeah, more just like even the some of this process really highlighted the value of just making some dedicated time, even though everybody is super busy, but just to pause and reflect.
Mm.
Everybody is so focused on these specific tasks, and you've got to get through your agenda. But just putting in away a bit of time, I will say, like for some of these, they were 25-minute focus groups, which you don't normally do, which you're able to just think, get some of that information and really use that to be able to streamline other things or to know a little bit more about what's working, what's not, and having that more ongoing reflection. I found has been quite helpful for the way that teams run. So, Dan.
Yeah. Okay. That was a great question by Sierra. And I was thinking about the flip side is, as Canadians, we try to be very nice to each other. But if something that is getting funding is unsustainable, other than waste, no, it would maybe time spent in trying to fix it is wasted time. How do you make that decision?
Um, I can start Zenat if
Go
you
ahead.
want. So I think that goes back to Zenat's slide about always asking if something should be sustained and having that as a regular part of a conversation. And it's so hard, especially because people are so, they put so much of their heart and soul into something. And then if it's not working, how do you reckon with that? And how do you not, like, how do you stop something, or how do you make that call, is a really difficult thing to do. But having that conversation and not having it as a one-time thing, I think, is part of what I've heard, and seeing that iterative process, but then also knowing at kind of what time point, because it's thinking about it not just from your um, perspective in that project, but what is the what is sustaining this potentially not letting happen? Like, is there something else that really is having that benefit that you want to be able to continue, and kind of thinking about it in some of those ways as well. But there's no easy answer to that question. But I think it's just having that as a conversation on a regular, on a more open basis for what that is. But and when
Yeah.
we're research too, it can be hard because you've got funding, you've got to meet it, you've got to meet your commitments, those kinds of things as well. But
Yeah.
And I think
So I'm not,
also,
just a quick for using it that you can, I'm not sure you addressed it in the slide. I didn't remember seeing it, but part of sustainability is evolution, right? And it's not same old, same old. Matter of fact, that becomes unsustainable. Um, and so I think this fits in. Anyway, you were going to make a comment, yeah.
yeah, I was just gonna say that I think it also goes back to the planning early on for a sustainability piece. So your question, I wasn't sure if you meant, something that just isn't sustaining or that it shouldn't be sustained. So if we go back to thinking about planning early on for sustainability, then hopefully we can mitigate that piece of it's just not being sustained because we planned from early on about, how to think about sustainability from the very beginning. And to your piece about the evolution, I think that goes towards the fidelity and adaptation, right? Where things are always evolving and changing and being able to think on demand about what can and should be adapted.
and that although the Oreo slide is a
Mm.
teeter-totter, or whatever you call it. But and that used to be more of the debate around fidelity and adaptation and like how core you need to stick to it. But there does seem to be a lot more recognition that you have to adapt to be able to continue to meet the original needs of that program. The population changes, your setting changes. There's so many factors, and that really brings us back to some of the need for the ongoing monitoring and evaluation of a program, because you need to be able to know if are you still having that benefit. And that can also be part of the evidence around should something be sustained, when you can go back to that initial piece, like you're not meeting your goals anymore. As much as you try and change this program to fit something, if it's just not fitting and your data is showing that you're not having that benefit that you want, then that's where more of those conversations need to come to.
Thanks for that. There's another question from Chris. Would you say that the network is evolving or has evolved into a community of practice in terms of the learning relationships it supports?
Sure about this one. Celia, do you have any thoughts? I think it also
Um,
depends on what we mean by community of practice, because there's so many
yeah.
definitions of that. Um,
Uh, yeah, I agree. If it's like a super broad look at being able to learn and connect together, then I think there's something there. But I think the network can potentially, or I think it does represent more than just a community of practice, because it is more than just the connections. It's more of the doing and the mobilizing and trying to advance a lot more, where I see some of the community of practice is working together and sharing and some of that. But I think the what we saw in some of the areas around like the benefits of a network means that it's gone beyond just a community of practice. But I think the essence of a community of practice where you want to be able to have people that have those interests to get connected, and that's part of what we should be trying to do as a network and in lots of different ways, and not just the people that are core connected to the network, but how do we bring in everyone else along the way in these kinds of webinars and other ways to be able to share that ongoing learning and those impacts that can come from it.
Thanks, Celia.
Um, so unless there's no further questions, I've got one final kind of comment that from just my reflections on putting this presentation together has been really interesting and working. It was quite a shame that Jess couldn't come because the way that she was able to connect with our results, and she really put it in a way that really highlighted how important this work is, and how people really need to be thinking about sustainability because it is having such an impact on everybody's individual lives and what that really means. So I really hope we can share that a bit further. We debated on canceling and all of those kinds of things, but wanted to keep going and making sure that her reflections are there. And we're also going to be continuing to share these results in other ways. So maybe we'll set up another presentation where she can definitely join once we've actually finished our analysis, because we are still very much in the middle of pulling this all together. So that's my reflections from this. So, Zina, any final thoughts?
No, I was just super happy to present the work, and excited to have it come to kind of an end after so many focus groups and interviews, but excited to see where the data goes and where the action goes for the sustainability of the
So
network.
much bigger than we imagined.
Yeah.
It's exciting. So we do have a
Okay.
final poll question, which I'll pull up now. And I did put a link to a feedback survey. If you can complete that, that would be greatly appreciated. It helps us a lot in planning these webinars. So I'll get the poll set up.
Right. And just to say that we haven't started advertising them yet, but there are plans in the works for some upcoming sessions that will continue around implementation science. And we're hoping that some of them can be co-hosted with the Kids Brain Health Network, because they're also thinking about some of the implementation. So trying to join forces on some of those. So there is one in the works around hybrid trials, I believe, and another around intersectionality and the different perspectives that people are bringing to this work. So watch this space as those ones get announced.
Thank you, Celia. So with that, I'll keep the poll going just for a couple more seconds. There's survey links in the chat, and we just want to thank everyone for coming to today's session and for your great questions and interactions throughout. Thank you so much.
Thanks, everyone.